Hi, Jan Herpin here, pharmacist, to talk to you today about IV admixing outside of the pharmacy. You will only do this in an emergency situation when you need it right now, or when the stability of the product is not long enough and you have to prepare it on site. Where do we start? First of all, we have to have a clean area for preparing this. So you will either have a clean countertop that you will sanitize with a cavi wipe, or a nice little apparatus like this little plastic area that will give you a good spot to sanitize and prepare your product. Wipe it down with your cavi wipe, sanitize it, and while that's drying, let's clean our hands. We all know we wash our hands for 15 to 20 seconds to make sure they're nice and clean. If you don't have soap and water, at the very least, then you use your sanitizer from the dispenser. That is an alcohol-based hand sanitizer, and make sure your hands are nice and clean. Next, let's get our gloves on, and we're ready to grab our products. So we're gonna grab our products, and we're gonna double check expirations on these to make sure they're within date. And we're gonna give that little bag a squeeze to make sure it's not compromised or leaking. Also, look at the bag and make sure there's no little particulate matter floating inside of it. We're gonna grab our syringes, and whatever volume we'll be transferring, you wanna make sure that your syringe is closest to that volume for more accurate measure. Make sure you grab your blunt needles, and if you're transferring from a glass ampule, you want to have a filter needle handy for after you've drawn it up and before you push it into the bag. Now remember, you are only allowed to add 2 products to this bag. If you need 3 or more products to be added to it, you have to get your product from the pharmacy. Let's grab an alcohol wipe and make sure you're going to sanitize the top of the vial and the port of the bag before you mix anything in. Once it's mixed, from the start of preparation to administration, you cannot surpass 1 hour time. You have 1 hour of time from time it's prepared to the time you administer the patient. If it is not administered within that hour, you have to discard your product and start all over. Once you've prepared it, you want to be sure and put a label on it so that it's identified with the name of the medication, the amount of the medication, the time at which you started preparing the product, your initials, and if you know the rate, then the rate that it is to be administered. You may need to check for compatibilities if your patient is on other medications or drips. You have access to clinical pharmacology through the internet, or you have your pharmacy as backup if ever in need.